Everybody, thank you all for attending today and joining us for another BRI Care Consultation Learning Collaborative. As always, today we have members of our BRI Care Consultation team with us, as well as another one of our Benjamin Rose colleagues, Rachel Cannon. And for today's Learning Collaborative, Rachel and I, along with David Bass, are going to be talking about best programs for caregiving, which is a free online directory of evidence-based dementia caregiving programs. And we're going to kind of walk you through this online directory and how it can be used as a resource. And so today's webinar will be recorded, and the recording and the accompanying PowerPoint slides will be made available to you after the presentation, which you can find on our resource library that we'll post in the chat. And then throughout the presentation, feel free to submit any questions you have using the Q&A or chat features at the bottom of your screen. And we'll answer those at the end during the Q&A portion of today's webinar. So as we get started here, I have two quick poll questions that I want to run just to get a better understanding of the group that we have attending today. So Molly, if you want to go ahead and bring up the first poll.
Hang on 1 second.
Okay. There we go. So the first poll question is going to be asking, are you familiar with the free online resource, Best Programs for Caregiving? And Molly, you can also, if you want to advance to the next slide, we have the question on the next slide as well. Thank you. All right, Molly, you want to go ahead and we'll look and see what those answers look like? So it looks like we have a handful of people who are familiar with best programs for caregiving, but maybe haven't really used the website before. And then we have a good portion of the people attending today who are not familiar but interested in learning more. So that's great. That's what we're here to do today with today's session. And then go ahead and go to the next slide, please. The next one is asking, the next poll that will come up is asking, do you implement an evidence-based caregiver support program at your organization? All right, maybe we can go ahead and pull up those results and see what we're at. So it looks like about half, a little over half, say yes, your organization is offering a caregiver support program, with the rest of responses saying yes and no, but planning to adopt. And there's no plan to adopt. Yes. Okay. So that's good. Good to know. Thank you all for completing those polls. That's helpful for us as we kind of walk into today's discussion. You can go ahead and go to the next slide, please. So I'm going to kind of introduce our speakers today. I am one of the speakers today, so just a little bit of background information on myself. I'm Morgan Minyo. I'm a research scientist here at Benjamin Rose Institute on Aging, and a lot of my research focuses on evaluating, scaling, and disseminating evidence-based programs for people living with dementia and their family and friend caregivers. And as part of this work, I'm a researcher for Benjamin Rose's evidence-based BRI Care Consultation program. And then I'm also a project team member for Best Programs for Caregiving. We also have Rachel Cannon, who is a senior research analyst at the Benjamin Rose Institute on Aging. She is the lead analyst in the initiatives that developed best programs for caregiving for professionals and for family and friend caregivers. And she specializes in research on the implementation of evidence based programs for older adults and their caregivers, and caregiving in diverse communities in collaboration with the Diverse Elders Coalition and its national member organizations. Then we also have Dr. David Bass, who is Senior Vice President, Senior Research Scientist, and Director of the Benjamin Rose Institute on Aging. He has led over 80 funded research projects on topics such as coping with chronic illness, family caregiving, quality of care and services, dementia and dementia care, use and impact of formal and informal supports. He is the lead developer of Benjamin Rose's evidence based BRI care consultation program and is also principal investigator for best programs for caregiving. So you can go ahead and go to the next slide. And I'm actually going to get us kind of started here today. You can go ahead and go to the next slide. Talking about best programs for caregiving, and like I said, how it can be a really valuable resource. But first, I do want to mention that best programs for caregiving is possible because of a great team of partners and collaborators who work on this project. So obviously, Rachel, David, and myself are a part of this, as well as our other colleagues at Benjamin Rose Institute on Aging, along with Family Caregiver Alliance, Katie Maslow, the Diverse Elders Coalition, Quality Process, and Bridge Builder Strategies. And then we also have our funders for best programs for caregiving, which is the John A. Hartford Foundation, RRF Foundation for Aging, and Archstone Foundation. Next slide, please. So, a major advancement in the field of dementia care and services has been the development and testing, and in some instances, scaling of evidence based dementia caregiving programs that have been shown to benefit family and friend caregivers of people living with dementia, and in some of these programs, also people living with dementia. But when Best Programs for Caregiving was first developed, there was no comprehensive, updated source of information on these programs that could make it easy to find and learn about these programs. And if you were an organization who was looking to start a caregiver support program, it was also difficult to figure out which program would be the best match for your organization, if there were other organizations that were offering a caregiver support program, and if so, what did that look like? What was their experiencing delivering that program? We also knew that family and friend caregivers struggled to find these programs and in a lot of instances even have an idea or have knowledge that these programs existed or that they had the ability to enroll in these programs. Next slide, please. So Best Programs for Caregiving was developed really to address these needs and with these needs in mind, and was first launched in 2020 with 45 evidence-based dementia caregiving programs. And all of these programs had beneficial findings from controlled research studies, and all of these programs had at least one real world implementation by a healthcare or community based organization outside of a research context. And like it sounds, the professional version was originally designed for professionals. So, with policymakers, funders, researchers, and most importantly, service organizations in mind, looking to be a really great directory and a great starting place for these service organizations to find extensive information on program characteristics. Again, other delivery organizations who had offered a caregiver support program, the experiences they had, as well as the research outcomes that established the program's evidence base. And so, after successfully launching the professional version in 2020, we conducted an evaluation of the experience of users who were going to the website. And we actually found that a lot of family and friend caregivers were going to Best Programs for Caregiving to find and learn about these programs, these caregiver support programs. But what they weren't able to find on the professional version was where these programs were located and if they were able to enroll in any of these programs that could be locally available to them. Next slide, please. So that's when we developed the public version of Best Programs for Caregiving, which launched around this time last year in April of 2024. And the public version is the first of its kind free directory that is designed for family and friend caregivers of people living with dementia. And it's also designed for any kind of service provider who is working with or supporting family caregivers. There are over 200 healthcare and community-based organizations listed on the public version that are currently offering one or more of the 45 evidence-based programs that is listed on the professional side of best programs for caregiving. And the way the website works is any either a caregiver or a provider who's supporting a caregiver can go onto the public version and insert their zip code into the search feature and find programs that are available to them in their community. And if they are available to them, they can learn about how that program is offered, whether that be in person or is it an online program that's delivered virtually or a program that's delivered mostly by telephone. They can learn about how to enroll in the program, who they should call and contact if they have more questions, as well as other key features that would be really important for both caregivers or a provider helping a caregiver know when they are trying to identify a program and enroll into a program. A number of these programs in the professional version, or a number of these program offerings that are listed in the professional version are available in person. But what we found is that there's also a lot of programs that are available at a statewide or a nationwide level. So that means they are offered virtually, either online or by telephone, and caregivers across the state or in some instances across the nation can enroll in these programs. And we also know that there's a select number of programs that have been adapted or translated for diverse communities, and the organization has provided the program to diverse communities. So again, all really important information when helping try and further access of these programs to rural living communities and individuals, as well as other underserved communities. Next slide, please. So that's just a little bit of background on how and why Best Programs for Caregiving was first developed. And I'm going to pass it now to Rachel to do a more in-depth live demonstration of both the professional and the public version of Best Programs for Caregiving, so you can actually see how somebody would navigate it online.
Thanks, Morgan. So I just pulled up here the homepage of Best Programs for Caregiving. So this is found at bpc.caregiver.org. And as you can see, you can access both versions on our homepage. So this includes on the right here, the version for professionals. So this is for program providers, healthcare providers, professionals, organizations who are looking to implement a program within their organization or community. And then on the left, you can access the new public version, as Morgan mentioned. It's for family or friend caregivers, as well as potentially care navigators who might be helping family and friend caregivers find evidence-based best programs for caregiving in their communities. So I want to just do a demo first of the professional version. So I'm going to click on I'm a program provider. And this will take us to our professional version homepage. So here you can learn a little bit more information about what's all included on the resource, the professional side, a little bit more about how to use the database. I won't go through all of this, but just to show you all, you can learn more about our funders, our partners in sustainability, and a little bit more about the project, including all of our project partners. At the very bottom, you can access our readiness questionnaire. So this is for organizations who are looking to implement a program, our frequently asked questions, program inclusion methodology, so that inclusion criteria to be included for programs to be included on BPC. We also have a promotion toolkit for those looking to help us spread the word about BPC, how to contact us in our privacy policy. So just scrolling back up to the top here, I can click here for programs. This is going to take me to our search page. So the search page initially shows up listing all programs are included in BPC in alphabetical order. So if I just scroll down here a little bit, you can see they're all listed here. You're going to get the program name, a brief description, and a little bit more information about each program, including who delivers the program, what format it's in, what languages the program is available in, session length, and program length for each of those programs listed. Just scrolling back up to the top, we have a few different options for filtering down programs. We do have this filter bar here. So if you have a specific program in mind that you're looking for, you can use that filter bar to search by program name or description. You can also see on the side here, there are quite a few different filters you can use as well to filter programs down by specific criteria. So just for example, types of dementia, whether or not the program's for other conditions, whether or not the program is offered in different languages, if there's a cost for the program, the different modes of delivery that the program can be offered in. So as an example, you might be looking for a program that can be delivered by phone. You can see that's going to filter us down to 26 different programs. The different types of assistance that the programs provide. So there's quite a few different filters on the types of assistance. You might be looking for a program that helps manage symptoms of dementia. Just another example, a program that helps monitor benefits of services. And that's going to filter us down to 10 different programs. Some other filters include the type of delivery person, such as a professional or lay leader that can deliver the programs, whether or not there's any initial training provided for delivery persons, as well as any study findings. So any findings in the research or beneficial outcomes that were found in those research studies, you can also filter down by any of those. So, caregiver well-being, support for caregiver, person with dementia well-being, just some different ways to filter down for programs that you might be looking for. Scrolling back up to the top here, you can see the different filters that I selected. It's showing 1 of 10 programs, or 1 to 10 programs. At any time you want to learn more about the program, you can click on this Learn More button. But we also have on the professional side a compare feature, and you can compare up to 3 programs at a time, as you can see. So if I select 3 programs, and click on Compare Now, this is going to take me to the compare page. So these 3 programs that I did select are 3 evidence-based dementia care programs recommended by the National Dementia Care Collaborative to use for implementing comprehensive dementia care under the GUIDE model. So this is along with 2 other programs that are also included on BPC, which you might have seen on the previous page, the Care Ecosystem Program and Aging Brain Care. Um, so yeah, just the compare feature. Here you can see you get that brief description up front. And as I scroll down, you can compare a ton of different information about these three programs side by side. If you're seeing any blank squares here, that's just means the information isn't relevant to that specific program. But as you can see, a few of these programs have specific target populations for characteristics of caregivers and persons with dementia. Some different languages that the program might be offered in. You can compare the different program costs, so whether or not a program has a cost or fee to obtain a license for an organization to deliver the program and what those costs and fees include. You can also compare some different program components, such as the theoretical framework that the program's based upon, the different formats of programs offered in, modes of delivery, who gets the program, so whether or not it's just the family or friend caregiver or person with dementia. And just a ton of other different program characteristics, such as what type of staff is needed to deliver the program. Is there any initial training or refresher training provided um, through the program? We also did a survey of delivery sites, so you can see here, this information will be comparable side by side. It's only displayed if we received up to 3 sites back. So you can see right now only BRI Care Consultation has information here. And I'll go through this survey of delivery sites a little bit more in depth, but just want to show at the very bottom here, then you can compare the study findings. So again, this is just outcomes that were found to be beneficial for caregivers and individuals living with dementia in research studies. So you can compare those different findings side by side in this compare feature. Okay, so scrolling back up to the top here, once you get a chance to compare these three programs side by side, you might want to learn a little bit more information about a specific program. At that time, you can click on See Program. And this is going to take you to the comprehensive program profile page. So this gives you even more in-depth information about this specific program. So again, that brief description and information up front, but each of these expands down into additional information to learn more. So again, those different target populations that the program serves, different program costs, any sources of program financial support that's available for the program, some different program components. So again, the modes of delivery that the program's available in. You'll get a ton of information about the different types of assistance that the program provides here, who that type of assistance is provided to, and how it's provided. And these expand down even into more specific types of assistance to learn more about those. Then again, just some more information about the different staffing that's needed to provide the program and that initial training that's provided. You can also learn more about the different tools that are available to help with delivery of the program, as well as any other delivery resources that are available. So we did conduct a survey of organizations that were delivering programs in the past 12 months. So you can get a little bit more information here about that survey, if we had enough organizations that completed it. And this really just shows you some different characteristics of the participants that organizations who are delivering this program served. I'm going to scroll through this quickly, but you can get quite a bit of information here. And also you can learn a little bit about the site experiences of these organizations. So did the organizations perceive improvement in certain outcomes for caregivers that they were serving? What types of strategies did they use to obtain resources to deliver the program or to recruit participants? What kind of challenges did they face with resources and support? So that all of that information is available here. And then again, at the bottom, you can look, get even more detail about the research evidence. So all of the studies that were done on this specific program are listed here. And you can drop down and take a look at the different outcomes that were measured and whether or not they were found to be beneficial in these studies. And you can learn a little bit more about each study, like how, what type of study it was, different details about that study, and learn more about the different research articles that were published. And then again, scrolling back up to the top on the side here, you can access those different program articles. So it's a list here of all of the published research studies on this specific program, and it links to where you can access that article. And then at the very top on the side here, when you're kind of ready to take the next step, learn a little bit more about the program, find out how you can get the program, those contacts are listed on the side here. So going back to our home page, I next want to give just a demo of the public version. Again, this version is for caregivers, family and friend caregivers, or potentially care navigators helping family and friend caregivers find evidence-based programs. We do have a YouTube tutorial here, just giving a little bit of background on how to use the website, to use the search function. But caregivers would, at this point, enter their zip code and click on View Programs. So you'll find here a list of programs that are available in that zip code. So as Morgan mentioned, this is going to include both programs that are available locally in person. So those face-to-face programs where they can go to the organization and get the program, um, as well as programs that are offered online nationally or statewide. So this might mean that a program showing up the organization might be located out of state, but it's still available in this zip code because they do offer it nationally in some sort of way virtually. So I'm just going to scroll through these here. You can see there's quite a few different programs listed. You're going to get the program name, the organization that's delivering it, a brief description of the program, and the different types of modes of delivery that program's offered in. So you can see there's quite a few different programs here. You might notice that the same program's listed twice. That just means that there are two different organizations offering that same program in that zip code. So at any time you want to learn more about a specific program, you can click on Learn More. This is going to take you to a more comprehensive profile of that specific program. Again, you're going to get that brief description up front, the different types of help that the program provides. You can get some more information about the organization that's delivering the program, where it's located, and the contact information. You can learn whether or not the program has a fee to enroll, and if so, if there are any payment options available. So you can see this specific program, there's no cost to participate. Any eligibility requirements for the caregiver or a person with dementia to enroll will also be enlisted here. And then information on how to enroll, exactly to enroll the program. So what phone number, website, or email to call to access that program. You'll also find the service region here. So you can see this specific program is offered nationally. So anyone in the US can access it. This being a telephone-based program. And then you can get additional program details here. Again, that mode of delivery, some information about the program and session length, who the program's led by. You can also link back to the information on the professional side here. So, if caregivers, care navigators are looking to learn a little bit more about this specific program, again, maybe what types of assistance the program provides, any research that was done on this program, this will link back to that professional side page that I just demoed. And then at the very bottom, whether or not the organization has adapted or delivered the program for different diverse communities. Those diverse communities will be listed here, and how, exactly how those adaptations were made. And at any time you can return to search, and that's going to take you back to your search page. So I'm going to stop there, and I'm going to pass it back to Morgan.
Thank you, Rachel. We'll wait for the slides to pop back up. Thanks, Molly. So now that you've had a chance to see the Best Programs for Caregiving website and kind of get a feel for the information that's included and how you would navigate it, I want to walk through the different users that would really benefit from Best Programs for Caregiving as a resource. And when we think of who could use this as a resource, the new CMS Guide Model Initiative is a great opportunity not only to incorporate evidence-based programs within your guide model implementation, but also using and also promoting the use of evidence-based dementia care programs. So I am going to call out specifically how BPC is a resource in the context of guide, but just know it's also not exclusive to guide. So this is also relevant to any kind of service organization or service provider that works with or serves family caregivers and is interested in implementing one of these programs at their organization. So when we talk about these users, again, the first one will be guide participating sites or other providers, other non-guide providers who are interested, like I said, in looking into adopting and implementing an evidence-based caregiver support program. So the professional version is going to be a great place to start that search. Then we have care navigators, again, maybe in the context of guide, or maybe it's a care navigator or care coordinator of a service organization not participating guide. So anybody who works with family caregivers can use the public version as a really great resource to help find and refer caregivers to available programs near them. And then also family and friend caregivers and people living with dementia themselves, again, using that public version to find those program offerings that are locally available to them. So you can go ahead and go to the next slide. And I'm going to go a little bit deeper into each one of these user groups and kind of talk a little bit specifically about the benefits that they would receive or how they would use this resource. And starting off with those guide participating sites and those other non-guide providers. So we saw during Rachel's demonstration of the professional version, the extensive amount of information that is available on the program characteristics for each of the 45 programs listed in the database. And while all of these programs were developed and tested and found to benefit family caregivers in one outcome or another, a lot of the, as you could see, a lot of the specifics about kind of the background and how these programs are designed, the types of help that they provide, and the way that they're offered are vastly different. And so, selecting a program for your organization that is going to meet the needs of your caregivers and the community that you serve is really important. And so the professional version is a really great way to help kind of narrow your choices down. So you could have one program that's delivered in person for 6 sessions by a professional and is designed to help caregivers with coping skills, with learning how to manage different dementia symptoms or difficult behaviors. And then you could have another program that's delivered completely online. And maybe it's actually designed for the caregiver and the person living with dementia to both participate. And the number of sessions and the length of sessions varies, and the types of assistance that this other program that's online provides is going to be different. So looking through the different options on the database, using those filter and compare features to really help you identify what are those needs that you have within your specific caregiving population and the clients that you're serving, and trying to find a program that's going to best address those needs. And then also there's a lot of key logistic information and implementation information that is also going to be just as important as the way the program is going to help caregivers, is also going to be, does that program align with the resources that are available at your organization? So we saw a lot of information about the background needed by the individuals who would deliver the program, if there is a cost to be licensed or trained to deliver the program, and if there is a cost, what is associated with that licensing or with that cost? How many training sessions do you get? Do you get manuals? Are there additional supports that are offered with a program? And so all of those things are going to be really important when an organization is trying to decipher which program is not only going to meet the needs of the caregivers that they serve, but is also going to be feasible and aligns with the resources and needs of their organization specifically. So again, using those filter and compare features will be really helpful to when helping narrow down those choices. And then once you have narrowed down those choices, we have the contact information of who to contact for each one of the programs. If you're interested in asking more questions, or you're interested in becoming a licensed organization, or you're interested in implementing that program, there is contact information for each one of the 45 programs that you can reach out to those programs and learn about what those next steps are. And if you're a guide model, one of the things that is those 9 care delivery requirements that are required as a part of being a guide model participating site or partner organization. There are programs within Best Programs for Caregiving that are care navigation or care coordination programs that meet all of the 9 guide care delivery requirements, or almost all of the 9 care delivery requirements, that you could adopt one of those programs and use it to help supplement your guide model implementation. There's also programs within Best Programs for Caregiving that only focus on caregiver education and skills training, which is another one of those guide care delivery requirements. And you could incorporate that program within your guide model implementation, again, as a supplemental program or as a regular service that you offer at your organization, maybe if you're not a guide provider. Next slide, please. So then the care navigators who are working with family caregivers or supporting family caregivers. So we know within the caregiving literature that the care situations are going to differ by each caregiver, and the kinds of supports, these types of services that they're going to need is going to be very different for each one and for each caregiver's specific kind of care situation or care dyad. And so, in the additionally, then in the context of the guide model, it's a requirement within the comprehensive assessment to identify the particular difficulties or the unmet needs of both the person living with dementia and their family and friend caregiver, and making sure that those needs are incorporated in their personalized care plan. And so the public version of Best Programs for Caregiving is going to be a really great resource for care navigators, both within a guide context and outside of a guide context, when you're trying to find available evidence-based caregiver support programs that, again, could be incorporated into your guide model, and or you could find available supports in the community and then refer the caregivers that you're supporting to one of those program offerings. As you kind of saw, and as we mentioned before, there's over 200 organizations across the U.S. that are currently delivering one of the caregiver support programs listed in BPC. And there are 16 different programs that are available to caregivers nationwide. And that's because, as Rachel mentioned, they are a program that's virtually offered. So they're either completely online or they're completely by telephone. And so what this means is that regardless of what zip code is entered into the public version, there's going to be options for caregivers to enroll in these programs. And so helping identify what a caregiver's needs are. If they need a virtual program and they need a program that's at no cost to them and is going to be delivered in a certain language, as a care navigator, you can put in that caregiver zip code and look through the programs that are offered or are available to that zip code, and then help them narrow down their choices. And in the best case scenario, helping them to use the contact information on how to enroll, to then either refer to that program or encourage them to enroll in the program as well to get the support that they need. Next slide, please. And then finally, the third user is family and friend caregivers and people living with dementia themselves. And that's really who the public version was originally designed for. So we wanted it to be user-friendly for these caregivers. And caregivers can use the public version in much the same way a care navigator would. So by entering in their zip code into that search feature and getting a list of the potential programs that they can access based on their geographical location or because it's a virtual program online. And then they're able to learn more about each program and find one that best suits them in their caregiving situation and aligns with their needs. And then at that point, also contact the organization if they have more questions or they're interested in enrolling in that program. So really a great resource for a variety of users, and a lot of users can use it in different forms. So go ahead and go to the next slide, please. And I'm going to now pass it to Dr. Bass to talk about ways that you can help promote best programs for caregiving with your networks and the people that you serve.
Thank you, Morgan. And thanks to Morgan and Rachel for doing such a beautiful job taking you through the website and showing how it can be used. And we very much appreciate all of you being here because our goal now is to get this website used. So by you being here and learning about it, you're helping us achieve our #1 goal. And obviously, this is a free resource. So it really is an easy thing for people to take a look at and has no cost involved. And our goal is to promote this as much as we can and make it as widely used as possible. And now we need help with promoting it. And that's why I'm here for this one slide. And I'm asking if you are in a place of an organization or in a situation where you can help spread the word about Best Programs for Caregiving is a free resource, we are asking for your help. If you're able to help us promote it, on this slide, you'll see in red type an email address that we're asking. If you send a message to that email address, bassonlineresource@benrose.org, we'll follow up with you and we'll make it as easy as possible for you to help us promote this website. We've developed toolkits that have options that you could choose from. Some organizations might be willing to put a link and a message about this website up on their websites, so people visiting an organization would see a link to BPC. Other people might be willing to put a flyer in an office where families come for services, or if you're working individually with families, having a flyer to distribute in some fashion or another. We can help with all that, and we'll make that as easy as possible. So our hope is that if you or someone you know or an organization you're affiliated with can help us promote best programs for caregiving, we need your help. So with that, I'm going to stop and go to the next slide for questions and discussion.
Thanks, David. And I think, Molly, you can probably go ahead and stop sharing, and we can maybe just have some of the panelists' pictures up. Yeah, sometimes that's easier than staring at the large Q&A. So thank you both, David and Rachel. And we can now move to the Q&A portion. So if you haven't already, we've had some questions already come in that have been answered during the presentation, and we might elaborate on a couple of them. But if you have other questions and you haven't yet asked them, feel free to put them in either the chat or the Q&A feature as we get started. But one question, and I think I'll direct this one to Rachel, that we did answer a little bit already in the Q&A, but I don't know, Rachel, if you can just provide further clarification. And the question was, does the zip code search feature only provide a list of that specific zip code, or does it include surrounding zip codes too?
Sure. So the zip code feature is actually based on service area. An organization who's offering a program will tell us what areas they serve. So if they're willing to serve or they're able to serve that specific zip code, then that organization, that program is going to show up in the search. So as Morgan and I mentioned, this is going to include both programs that are locally available in that zip code. So you may be able to go into in person, but it's also going to include those programs that are available nationwide. So caregivers can access programs that might be offered by an organization that's out of state, but they'll still be able to access that program virtually in some way, either online or telephone.
Thanks. And we have another question that is similar and asks, if we have a client living in a rural area / not a lot of services, and they use the zip code search feature, will there be any place to refer them to? So yes. So the answer to that is yes. So there are 18 different programs right now on Best Programs for Caregiving that are being offered on a nationwide scale. So any caregiver across the US, that is being offered by 25 different organizations. So what that means is that anytime a zip code is put into the search feature, there's going to be at least 25 different options that come up for an individual. Now, there may not be any of those 25 offerings that are in person, but there will be offerings that are either that are virtual, either online or are telephone based. So an option will pop up for each individual. Let's see. Another question we have is, how are organizations paying for programs? I know, David, if you want to talk maybe a little bit about different funding streams that these programs receive.
Sure. So one of the things we've learned is that most of these programs across the 220 or so organizations are being offered for free to families, about 85%. And the remaining 15%, some of them offer financial assistance. So they're doing that in a variety of ways. Some organizations have grants that enable them to deliver the program, grants, for example, from a local foundation or grants from Administration for Community Living. Some organizations are getting funding through the Older Americans Act, Title III, through their area agencies on aging, or they are an area agency on aging. There's some programs funded by county levy money. And some of the programs that are remotely delivered are very economically delivered, so it doesn't cost a lot. So lots of options for how organizations support these programs, lots of programs that are free to the public.
Mhm. And I think the only thing I'll add, and Rachel, you can correct me if I'm wrong, but one of the pieces of information that's provided on the professional side is the different funding sources that organizations have used who completed our delivery survey. And so there should be a list for each program. There should be a list on their individual profile page that shows how different organizations specifically funded that program, whether it was under grant funding or federal or some other kind of federal funding. One question we had is, I'm not sure if I missed this, but are there any programs available in Spanish? Rachel, if you want to take that one.
Yes, there are. So that information, when you do the, if you're looking at the public version, you do the initial search for zip code. You have to click on the Learn More button, and you can find in that profile page for that specific program whether or not it's delivered in different languages, including Spanish, any other languages other than English.
Thank you. And we've had a couple of people in the chat and in the Q&A talk about wanting to promote in kind of in context of what David was talking about, and wanting to have more information about how they can promote this. So following today's session, when we send out information about how to access the recording for today, along with the PowerPoint slides, in that same email, you'll receive the information of the marketing toolkit that you can help to promote within your own communities. Okay, another question we have is, how often is the information being updated? A lot of these programs are only offered for a few weeks sometimes. So I can start with that, and then David or Rachel, if anybody wants to chime in. So the professional side and the public side, we do regularly update, just on slightly different cadences. So the professional side, which has the 45 evidence-based programs, we update the information on those 45 programs annually. So we're making to see if sometimes program developers do adaptations of their programs, either for other modes of delivery. Say it's an in-person program and then they want to conduct a research study to test it, then being delivered virtually online. So sometimes there's adaptations and we collect information on that and make sure we're updating it. Or if they've translated the program for a diverse community. So there's information about our existing programs that we update annually. And we get new information about the sites that are delivering those programs. So we try and keep that information updated, as well as adding any new programs that meet our eligibility criteria. And again, those main eligibility criteria being a beneficial research finding and a peer-reviewed publication, as well as an implementation of the program in a real-world setting out in the community. So then the public version, we update every 6 months. Obviously, we know there's a lot of organizations who have either limited funding for the program or potentially staff turnover issues or issues getting enough caregivers enrolled into the program. And especially since we're sending caregivers to the public version, we want to make sure that that information is as up to date as possible. So we do update the information on the public side of the organizations who are offering the program and their contact information and so forth every 6 months.
Just to add a comment on that is we try to give as much information as possible so that when someone wants to use the program, they can contact the organization and find out the very specific details about when programs are offered, when's the next session going to start, and the kind of things you'd want. So we try to keep it as updated as possible, but really it does require at least one phone call to find out exactly when a program's available.
Another question we have is, are any health systems offering BRI care consultation? David, do you want to talk about that?
Yeah, I can't give you an exact number. We have less than 10, I'll say, health systems that have done BRI care consultation under a licensing model that we offer from Benjamin Rose. And we provide all the training, the software for delivery, manuals, everything a healthcare system would need to do the program comes with that licensing model. We also at Benjamin Rose have a model where an organization like a health system that might want the program for their clients or families can contract with us to deliver the program. So we offer this program on the Benjamin Rose services side. And because it's primarily telephone-based, supplemented by online resources, it can be done anywhere in the nation. And we have some health systems that are contracting with us to deliver the program for their families. In total, I'll say probably 10 or so organizations that are health systems have contracted with us or gotten a license to do the program.
Thank you. It doesn't look, we have about 8 minutes left with our time here today. We don't have any more questions coming into the Q&A. So if you have a last minute question, feel free to put it in there. But while we wait, just to make sure there's no last questions, I do want to just mention, so we have our our next learning collaborative, which will be in April, April 9th, again, from 3:30 to 4:30. We don't yet have the registration link for that open, so be on the lookout for that. We will be sending it. And at Benjamin Rose, we do offer one-on-one consultation for both best programs for caregiving and BRI care consultation. So if you're interested and you have follow-up questions either about best programs for caregiving or BRI care consultation, please feel free to reach out to Michelle Palmer. We've posted her email in the chat there, and you can contact her if you are interested in either of those options. And then finally, I do want to mention that the National Dementia Care Collaborative has a free webinar coming up next week on March 20th at 3 p.m. Eastern Time. And they will be going over some of the challenges with the respite requirements under the CMS guide model. And they have a couple of speakers who are going to be talking about different strategies that they've used as established program tracks within the guide model. So we've posted the link to register for that session also in the chat. And it looks like we have one more question that just came in. It says it appears that the rates set by guide are below market rate. For example, the respite care under guide seems to be set at $30 per hour. Is this actually achievable? Should this be an area we advocate to increase? So I think that's a great question, and I don't think you're alone in that concern. I think that the guide model requirements related to the respite services in particular have been a challenge and a barrier for a lot of guide participating sites. But I think that there's also a lot of success stories that different sites have come out of it and ways to overcome those barriers that established tracks have started to kind of navigate. And so I would highly suggest you attend and go to the NDCC's webinar that we posted in the chat. They have a great lineup of speakers for that session, and it is free and virtual to attend. So hopefully that might be a great resource for anybody looking for those respite questions related to guide. All right. Well, I think that'll bring us to a close today. Thank you all for attending, and we hope to see you in April. Bye.